Welcome, everyone, to Ladder Daily Digest. We honor creators, and today we have a special creator, a chiropractor. His name's Brett Judson. It's very similar to my name, and Brett happens to be my son. Welcome to the show, Brett.
Glad to be here. Thanks for inviting me.
I have appreciated all the things you've done in your life to be organized and get ready for your future career. And so I thought I'd bring you on the show and let you talk maybe for 5 minutes or so and talk about what life was like growing up around here in the San Francisco Bay Area and what influences might have happened to you that led you to choosing the health care field.
Yeah, so life growing up in the Bay Area was great. Sunny all the time, playing sports, being out late. I remember rules were once the sun comes down, that's when I needed to head back home. So that was kind of my life for growing up, childhood. Getting into high school, playing sports, appreciating the amazing ability of the human body, being very curious about the human body and how it works and injuries and trying to help them and fix them. And, growing up close to a chiropractic school, there were a lot of chiropractic students that attended my church growing up, and they would share a little bit of their philosophy. And one of the topics in my mind were about, like ibuprofen or Tylenol, pain meds, are they really working? Is it really fixing it? Chiropractic philosophy shared to me from the students where we try to find the root cause of the problem. So that's why they look at the spine, the nerves go through the spine, the nerves connects the body and the brain, the communication that flows from the organs and muscles back up to the brain, that communication cycle. If that gets interfered with, well, then function is interfered with. And so correcting the spinal restriction, or what we call subluxation, allows that communication to flow freely, and it allows the body to heal and resolves the problem. They say that's the root cause for a lot of. It's the first philosophy that I noticed trying to find the root cause of the problem and fixing it. And
Right.
all the pain meds and medications, they are symptom relief. The analogy that I always said in my mind: if you're going to pull a weed out, you got to pull it out by the roots. You can't just snip off the leaves. Now, I'm happy we have pain meds because when I have a headache or when I'm hurting, it's good for the temporary relief. But again, it's not fixing anything. It's our own body that is always fixing everything. Pretty much, I would say the majority. I can't say not everything, but the majority of things that ails us, we do in the medical field. Or not we do in the medical field, but the medical field tries to support the body and the symptoms so that it's easier, and still the body's healing itself. Now, chiropractic, we don't do any drugs, but we help the body heal itself by increasing its own ability to function.
Most people don't realize that a doctor, and what we say would be a normal or average doctor that everybody would notice as, what their profession is, they're actually doctors of medicine, right?
Yeah.
So that's a little bit different. Also, tell us a little bit about things that you did, like did you have leadership callings in church as a teen, other things that, any achievements in your life, maybe sticking to some program or whatever helped you, train you to be like a good student and to give you the habits of success?
Yeah, I mean, earliest I can think of was obviously the Boy Scouts of America. Progressed through that and got my Eagle Scout award at the very last moment, like I think a lot of people do. Going through high school, early morning seminary, waking up early, being disciplined to wake up at, 5:30, 5:45 in the morning, get there by 6:20, and not very many teenagers would do that. But
And so we had early morning seminary, and one thing I will brag about Brett is that before he had his license, he would often ride his bike to seminary in the dark, about 1.5 miles. That was pretty brave, pretty courageous, and also it helped you gain some strength in your legs, I bet, every now and then.
For sure. I mean, not to mention I was also playing sports, and so I'll need to bring my sport gear. During the summer, I would ride my bike with my before we had lockers assigned to us, I would have to bring home my football helmet and pads. And so I would have pretty much on one shoulder my bag of clothes, and then on the other hand, my football helmet and shoulder pads. And I would ride with one hand, about a mile and a half to school during the summer. Once school started, we had lockers for our gear, but then I would play the trumpet, and I'd bring it home to practice, and I'd bring it to school. So I'd ride with my backpack, with my clothes, and then still one-handed with my trumpet in one hand, riding to school or early morning seminary in the dark.
That's right. I forgot about the trumpet. And so I remember having a dream of you like being the quarterback and at halftime
show,
playing in the marching band, and then with your football uniform on, and then like having somebody take away your trumpet and then go back out there in the second half, run the team or something like that. That never happened, but it was a fun thought,
Yeah, I couldn't do it. I think I brought it up to the coach once, but he goes, "No, we need you with the team huddle, halftime, figure out what to do for the next half of the game." So I wasn't.
Yeah, that was at the time where I didn't realize how much coaching goes on at halftime for correcting the things that are going wrong, or to find weaknesses in the other team so that you can exploit them and stuff like that. So you graduated from high school, and then what happened?
So I graduated from high school, worked for a year. My first job was like an HVAC technician, very simple, just plug in the sensors and do what the computer said. Did that first summer, then with the same company, helped with the winter duct sealing things that didn't last for very long. Then worked at a day camp for mentally disabled adults for a couple of months. Then went on a 2-year church mission to Brazil, to Rio de Janeiro, where I learned Portuguese, and came home in 2013. Started going to community college, Chabot Community College. Tried out for the baseball team, but then got a job, and then decided to, be a full-time student and then work part-time. I couldn't be. I decided not to do the sports.
That's right. That ended your sports career.
Yeah, that pretty much ended it. I'd play every now and again, but worked with the school. Then a year after that, found a girl, a Brazilian girl in California, showed off my Portuguese a little bit, and I guess it was good enough. And so 3 months after we met, we got married. Then a year after that, I finished my 2-year degree. I actually got 2 associate degrees, one in science or math and science, and the other in kinesiology. And then finished my 4-year degree at BYU, Idaho, and that was in exercise physiology. And sometimes I joke around and say, I know the benefits of exercise, I just need to do more of it, or I don't do it as much as I should. Then I moved back to California to go to chiropractic school because, before that, I was contemplating either physical therapy or chiropractic. And my network of known chiropractors and friends and support system was way bigger in the chiropractic realm than physical therapy. And I like the idea of really trying to help people in all aspects and not just the biomechanics.
How many years do you go to chiropractic college?
Chiropractic school is normally 3.5 years. But since I had a background in science and anatomy and physiology, that I was able to do the fast track, and so I shaved off 6 months from my education, so 2 quarters, and so that saved me around $25,000 in tuition, which is good. But yeah, I went through school in 3 years, where the normal track is 3.5.
And I know there are different types of chiropractors. Maybe you, in very simple layman's terms, what are a few of the different types of chiropractors compared to a family chiropractor?
Yeah, so I would consider myself a kind of normal family chiropractor. We adjust the full spine. The technique is called diversified. It's the most common technique that you'll see a chiropractor do. Full spine. Some chiropractors but add like extremity adjustments like shoulders, arms, legs, which I do as well. Some chiropractors will focus on only the top 2 vertebrae. They're called upper cervical specific. They have different techniques just for those. I would consider them to be more of a specialist within chiropractic. There's lots of different techniques. I heard it said you go to 100 different chiropractors, you'll see it done 100 different ways. Chiropractic is a science, philosophy, but also art. Each chiropractor has their own signature, or the way that they do things they gravitate towards. So it's never going to be the same experience in every single office. The adjustments may feel very similar, and I would say that's very uniformly felt, but some will add physical therapy, some will add other forms of treatments or exercises. It just kind of depends what the chiropractor wants to do. But I would say a family chiropractor. Others really try to market towards like children and pregnant women. People forget how traumatized, or not forget, but they don't realize that it's also traumatizing for baby as much as it is for mom.
Yeah. I don't remember when I was born.
You don't remember when you were born?
So I did forget it.
I mean, I have kind of a cool experience with my firstborn. I was in chiropractic school, and right when he was born, I thought, all right, now I got a baby to practice on. Babies don't come in the school very often. And so, I'm feeling his neck. I'm also noticing things about his body. He's not turning his head to the left. And I thought, well, let's try to turn it to the left. Now I would get it to about center, and he would kind of fight it a little bit, and then he would just go back to the right. And I'm feeling the top part of his neck, and I'm feeling it's really tight on his left side. And so now I'm having him facing me, and then he starts to turn, but my finger is on that tight spot, and I feel the bone shift, and immediately afterwards, he turns all the way to the left. And so, what could be the possible issues that if I didn't correct that, although it was on accident, now it could have gone back in spontaneously, right? Kids' spines are all cartilage, and when they move, things can shift easily. But if it doesn't, well, we have a cranial nerve called the vagus nerve. It goes down and it activates the rest and digest part of our nervous system, and that goes to all the organs in the body. So if that nerve is getting interfered with somehow, then you can have a colicky baby, a baby that doesn't breastfeed right on one side, a baby that doesn't take naps very well, doesn't rest very well, and becomes irritable, fussy, extra. So there's lots of things that can happen that could have happened with him. And honestly, he was my most perfect baby of all of them. Now, my second baby, I tried to, adjust and find the subluxations, and he was very difficult.
He wasn't having it.
But he was just a different baby, so the adjustments wasn't his thing that he needed. There were other stressors for him. But yeah, it was just a kind of
So if there's something going on with the nerves, the muscles tighten as a way to like protect that area. Is that what happens?
When there's a restricted joint, the muscles will contract around that area to try to guard and protect. That's what they do.
And what else do you do to help those contracted muscles? Do you do anything special?
Yeah. So there's this muscle technique called active release. And with this, it's just a really strong stretch. And so obviously we don't really do this on infants, but for adults, the muscles control the movement of the bones. And so when we adjust the bones that aren't moving well, that's, in my opinion, one piece of the puzzle. And so the muscles that also go to that joint will be hyperactive or tense. And so stretching those muscles out will then bring that unit into a much better harmony and relax the whole area. And people get so much better results with this added muscle work.
A little bit more, not spontaneous, but immediate relief.
Yeah, definitely way more immediate relief, because we get some motion restriction in the joint, but we can also get motion restriction from a tight muscle.
So if you didn't do the stretch, the muscle would eventually relax, but
sometimes.
But the stretch helps it a little faster.
Sometimes. I give this example where I would only adjust someone for 2 weeks, and they would still have low back pain after the 6th adjustment. And I'm thinking, why after 2 weeks, like almost nothing happened after this last session? And so I would dig a little bit deeper, kind of re-examine, I guess, the area, and notice that the joint inflammation was pretty much gone, and that wasn't hurting the patient anymore. But what was hurting the patient was this tight muscle. And so we stretched that muscle out in this special technique, and immediately he would pop up and go, that pinch is gone. It's not there anymore. And so since then, I'm like, I have to, in order to get patients better, I have to include this muscle work from the beginning. And I see that day in, day out, patients get so much better. Even within the first visit, their range of motion increases, their pain decreases. They're feeling so much better and so much happier.
So Brett, about how many years have you been practicing chiropractic? And I understand you recently opened an office. Yeah.
So I graduated in 2021, but I was doing what's called a preceptorship, a non-paid internship, at a local chiropractor in California. Gained a lot of great experience. Very grateful for that. And so I started about 6 months before I graduated, and then worked with him for another year. So I was with him for
That reminds me, in order to graduate, you have to see how many adjustments do you have to make in order to graduate?
Oh, the exact number. I think it's like 250 adjustments, a certain number of exams, a certain number of modalities. There's a lot of different requirements. And usually you have four quarters. You have 1 year to really attain those numbers. One, I would say, pretty neat achievement that I was able to do. I was able to achieve those numbers in 2 quarters. Okay. So essentially, I could have graduated after that, but I still had 2 more quarters of other classes.
And I know at first,
experience, it was pretty much done.
At first, the students work on each other, and then this college has a clinic where outside patients can come in and get treated. They are mostly, there's a supervising doctor, then the students present to the doctor what their findings are, what the treatment plan they should be. Did the doctor guide you guys or did you learn enough in the prior 2 years to have pretty good diagnoses and plans?
The way that my doctor is Dr. Herbie Bell, shout out to him, he's awesome. He guided in a way that allowed us to, feel like we were the doctors. We didn't go to him and say, "Am I doing the right thing?" We went to him and said, "This is what I'm thinking about doing." And then he would just ask questions. Well, what do you think? Is this going to help the patient? Look at your exam findings. Is this your decision?
Line.
And then he would always say, "Well, are you going to hurt the patient?" And we would go, "I don't think this will hurt them." He goes, "Okay, go ahead."
Yeah, so that's like the Socratic method, right, of asking questions and getting to the answer. So you did the preceptorship, and then what happens after that?
Then after I got my official license in May, then I was licensed to treat people, and I didn't have to have the supervision of another doctor in the office. After I got licensed, the owner, took more time off and kind of left me with the patients, and I would ask him questions, and things were confusing still. And but with that, did that for another year, and had an opportunity to purchase a home in Utah, and found another doctor to work for, and then working with him for about 4 months. I really wanted to try to focus on helping the patients get better, but there were office procedures and systems that were preventing that. And so it became a place where I didn't feel like patients were getting the best results. And so we parted ways, and I was left with an opportunity to open up my own office. And I have no regrets. There's a lot of learning involved. It's a lot harder. But after this learning curve and getting things going, where I can focus on getting patients better the fastest way possible, and I'd say that's going to be the secret to my success.
That's
and
right. When you're a student,
it's been great.
When you're a student, you don't have to worry about the billing or insurances. But then when you go out in the real world, how much of your time is spent dealing with insurances compared to working with patients? I mean, is it 10%, 20%?
Well, that's why I hire people to try to do those things so that I don't have to, right?
Right. But if you had to do it on your own.
Oh yeah, if I were to have to, I wouldn't be able to do it on my own. I would have to essentially live here at the office and take 10-minute breaks every hour or so, but it would just be a nonstop thing because I'm seeing on average 25 to 30 people a day that I'm open, and the work just keeps piling up. I mean, I'm still behind on my own visit notes. I have a pile to do.
Yeah.
So yeah, there has to be a team involved in order to get this done, and we're still learning the software and how to use it to our advantage. And I'm paying for the software to be more independent and automated to make it easier, but it's still a learning curve. But once we learn it, then it'll go smoothly. So I'm expecting by next year, January of next year, we should have a smooth running system.
That's right. Well, thank you very much for coming on our show, Brett. Dr. Judson, has a nice ring to it.
Yeah, how does it feel to have a doctor in the family?
It feels pretty good. that means I know that in my old age, I'll be taken care of, maybe. Anyway.
Yeah, probably.
Everybody have a nice summer. Like and subscribe. And we've interviewed other healthcare professionals, and I just enjoy people that have, decided to engage in a career that, helps other people. So doctors, therapists, all kinds of people that we've interviewed, podcasters. I'm all about celebrating creativity and helping others. All right. Thanks a lot. Bye-bye.
Bye.